I'm with Dr. Kevin Vigilante, Senior Vice President, Booz Allen Hamilton. Hello.
Hello.
What are you discussing this year at the World Healthcare Congress Middle East?
Well, this year I've been asked to talk about issues related to knowledge transfer and sort of the best practices in knowledge transfer and how you do it successfully and what are the pitfalls in that arena, which is a pretty complex environment.
Why is it important to have such an event?
Well, I think, as we look at the complexity of healthcare and the premium that's being placed on practicing in an evidence-based way, good practices, better practices, best practices are always emerging, but it's very important that we are able to push these out and scale them across the industry so that people actually adopt best practices and use them in caring for patients. And it's surprisingly difficult, frankly, to actually disseminate best practices in a way that people can use them in their day-to-day work. And so I was talking about some of the challenges and some of the ways that we can address those challenges.
Why is it difficult?
Well, we often think that if we tell people what they need to do based on the evidence, that they'll be able to do it. The problem is, individuals work in large organizations and in order to actually implement what needs to be done requires a change in behavior.
And of the whole organization?
Well, multiple individuals have to change, the teams they work in have to change, and often they're unable to make those changes unless you also change the processes by which care is administered. So there's this important component of process redesign that goes with adoption of best practices and the behavior change that's required. And frankly, we don't do that well in healthcare. And so we have to learn how to embed the capability of process change within our healthcare institutions.
And probably not only change, but doing it fast enough.
Yes, and so, so if you think about healthcare, it is the most complex production environment probably on the planet. And yet we really don't impose engineering discipline on how to deliver that care as we do in other industries. So this idea of bringing industrial engineering to the healthcare environment is very important. And so in the future, it's not going to be sufficient just to train physicians who know how to deliver care. We have to actually train physicians who understand the principles of process redesign. And the same way, not just physicians, but nurses, clerks, everybody who's involved in delivering health care really has to understand how they redesign the processes by which they do that care. Because frankly, unless they're engaged, the processes won't get changed correctly, they won't buy in, and best practices will not be adopted. And this is very hard work, and we give precious little attention to how to do it.
What are some of the innovations your organization brings to healthcare?
Well, Booz Allen's an interesting organization. It's a very large consulting firm, 25,000 people, and we have a great deal of expertise, ranging from folks who are computational biologists to folks with deep expertise in change management, to data analytics, to a whole spectrum of capabilities that we bring to bear for our clients. But I would say what we bring that's different than many consulting firms is because we work with governments. We don't just sort of say, oh, okay, this is the strategy, you guys go off and execute it. We're actually focused on implementation. So we'll help develop a strategy, but then we'll stand side by side with our government and commercial clients in helping them implement it. We partner with them. And our goal, as we implement the strategy in a very practical way, is then to transfer knowledge from us to our clients so that then they can sustain it, so they won't be dependent on us. So over time, we're involved in knowledge transfer so that they can be off and running and self-sustaining. So I think the special sauce of what we bring is this focus on implementation that many tier one consulting firms don't provide.
Healthcare knowledge transfer is very complex. How can we ensure that knowledge transfer is effective?
Well, measurement.
Measurement.
Right, so I think on the one hand, this attention to sort of say we're not just transferring knowledge, it's about transferring capability. It's not just about knowing something, it's about doing something. In order to do something, you have to change behaviors. And you have to change behavior in the context of process change. So it's a total package that has to be brought together to be effective. But then, you have to measure it. And measuring, very often people, when they're measuring knowledge transfer, they measure inputs. How many people did we train? How many, wrong. You got to be focused on measuring the outcomes, how it impacts patient care, how it impacts the experience of the patient. And so on the front end, having the right approach through process change and behavior change. On the back end, measuring and then feeding back to those frontline clinicians and staff who are implementing the change, the effects of the change based on the measurement. And through that feedback loop over time, you refine your best practices and then you refine your performance.
Why does transfer of best practices often not work?
Well, people fail to pay attention to the behavior change and the process change that are essential to make it work, and that is the hard work. Because very often we ask people to do it, but they don't have the skills to do the process change. And so that, I think, is the single most important dimension of failure, and because we fail to adopt it or adapt it to the local cultures and idiosyncrasies of any given institution in different parts of the world. And very close attention to that is absolutely important.
Is it about culture and tradition? Is it difficult to implement because of culture and tradition, and it's a process of working towards finding a happy medium, or?
Yeah, sure. I mean, I think that...
Or is there something else?
Well, it's both, right? So the process by which you implement a good practice or a better practice even in the same country, at a different facility, because you have an academic facility and a non-academic facility, a large and a small, some with one physical layout versus another physical layout. How you do it's going to vary based on the institution that you're trying to implement it. But then there's also cultural overlays, and how you do it in Beijing may be different than how you do it in Utah, which may be different than how you do it in Jordan or in the UAE.
And how it's accepted in each.
And you have to be which is why the frontline staff in each of these places has to be involved in the change, because they will provide you with the cultural sensitivities and the practical day-to-day realities of what they do that will make that change work in their environment. If you don't engage them and their culture and their perspective in their place of work, it won't work, it won't endure, and it won't be successful.
Can you tell us about your experience in implementation of health projects?
Well, that's a long story. I mean, because we do hundreds, thousands of them across the country and across the world, and so it would be hard to kind of sum up. I do think that the key, though, theme is partnership. You know, when you're working with clients, it cannot be a unilateral, the consultant knows best approach. You really have to understand your client's needs, always be in communications, and you have to be a good listener. Because if you're a good listener, you will understand the problems better, and then you partner with your clients to arrive at a solution. And so I think no matter what engagement you're talking about, that is a fundamental precept, and one that we live by as consultants.
Dr. Kevin Vigilante, thank you very much.
Well, thank you. Thank you for the opportunity.